I think everyone panics when you hear the word virus, but do you know what exactly a virus is? Well, a virus is the smallest of all the microbes. They are said to be so small that 500 million rhinoviruses, which cause the common cold, could fit onto the head of a pin. They are unique because they are only alive and able to multiply inside the cells of other living things. The cell they multiply in is called the host cell. It spread from person to person, mainly in droplets that fly out when you cough or sneeze. These tiny drops from a sick person moves through the air and land on the mouths or noses of others nearby. Viruses, and the diseases they cause, often have different names. For example, HIV is the virus that causes AIDS. People often know the name of the disease, but not the name of the virus that causes it. n-cov is a provisional name, given to coronavirus of medical significance, before a permanent name is decided upon, although coronavirus are endemic in humans and infections normally mild, such as the common cold, caused by human coronavirus until the 15% of cases, cross-species transmission has produced some unusually virulent strains, which can cause viral pneumonia and in serious cases even acute respiratory distress syndrome and death. The recent outbreak began in Wuhan, a city in the Hubei province of China. Reports of the first COVID-19 cases started in December 2019. Coronavirus are common in certain species of animals, such as cattle and camels. Although the transmission of coronavirus from animals to humans is rare, this new strain likely came from bats. The one study suggests pangolins may be the origin. Experts say SARS-CoV-2 originated in bats. That's also how the coronavirus behind Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, SARS, got started. SARS-CoV-2 made the jump to humans at one of Wuhan's open-air wet markets. There where customers buy fresh meat and fish, including animals that are killed on the spot. Some wet markets sell banned species like cobras, wild boars, and raccoon dogs. Crowded conditions can let viruses from different animals swap genes. Sometimes the virus changes so much, it can start to infect and spread among people. Still, the Wuhan market didn't sell bats at the time of the outbreak. That's why early suspicion also fell on pangolins, also called scaly anteaters, which are sold illegally in some markets in China. Some coronavirus that infect pangolins are similar to SARS-CoV-2. As SARS-CoV-2 spread all over the world, it infected people who have had no direct contact with animals. That meant the virus is transmitted from one human to another. It's now spreading in the US and around the globe, meaning that people are unwillingly catching and passing on the coronavirus. This growing worldwide transmission is what is now a pandemic. However, it remains unclear exactly how the virus first spread to humans. Some reports trace the earliest cases back to a seafood and animal market in Wuhan. It may have been from here that SARS-CoV-2 started to spread to humans. It spreads mainly by droplets produced as a result of coughing or sneezing of an infected person. This can happen in two ways: direct close contact. One can get the infection by being in close contact with corona patients within 1 meter of the infected person, especially if they do not cover their face when coughing or sneezing. In direct contact, the droplets survive on surfaces and clothes for many days. Therefore, touching any such infected surface or cloth and then touching one's mouth, nose or eyes can transmit the disease. Using current initial data, the median time from onset to clinical recovery for mild cases is approximately 2 weeks and is 3-6 weeks for patients with severe or critical disease. It affects different people in different ways. Most infected people will develop common illness and recover without hospitalization. Some common symptoms: fever, dry cough, tiredness, aches and pains, sore throat. Some less common symptoms: diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on the skin, or discoloration of fingers or toes. Some serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention. If you have serious symptoms, always call before visiting your doctor or health facility. Currently, no medication is recommended to treat this virus, and no cure is available. Antibiotics aren't effective against viral infections such as COVID-19. Researchers are testing a variety of possible treatments. The FDA granted permission for some medications approved for other diseases to be used to treat severe coronavirus, but no other options are available. Two malaria drugs, hydroxychloroquine and chloroquine, and an antiviral drug, remdesivir, have been approved for this use. But there is still one thing we are missing, which can help our body to fight with this virus. That is our immune system. The idea of increasing your immunity is enticing, but the ability to do so has proved elusive for several reasons. The immune system is precisely that, a system, not a single entity. To function well, it requires balance and harmony. There is still much that researchers don't know about the intricacies and interconnectedness of the immune response. For now, there are no scientifically proven direct links between lifestyle and enhanced immune function. A healthy immune system can defeat invading pathogens, where two bacteria that cause gonorrhea are no match for the large phagocyte, called a neutrophil, that engulfs and kills them. What happens if you have weak immune system, and you get this virus? Can you recover from it? The answer is yes. You can recover from the coronavirus. Catching the new coronavirus does not mean you will have it for life. Most of the people who catch COVID-19 can recover and eliminate the virus from their bodies. Who knows? This virus is transferred from another species, which do not belong to our planet. That sounds like a spoiler for another exciting topic for you. We hope you enjoyed. Let us know which of these are your favorite in the comments, and if you like the video, make sure to give thumbs up, and subscribe and turn on notifications, so you will be the first to know when the video arrives. You can also follow our social media account in description. Thanks for watching.